Hi. So this is a special video for emergency services new staff who are having some difficulty with their technology in their building and seeing the profiler screen. So this is going to be a long video because it is customized for users in ES who have never used Profiler before and who would be getting their brand new training. So bear with me, it's going to be a little long, but I want to make sure you have all the information you need. Okay, first off, I want to show you how to change your password in Profiler. You go to the Start button at the very bottom left-hand side. When you get a generic password for Profiler, you want to make sure that you change it and it's customized to you. Okay, so I'm going to go to Start and then Windows Security, change a password, and where it says old password, you're going to use whatever the IT department gave you to log in, and you want to put your new password and confirm password in there, and then hit the arrow. You may make it the same password as your network login if that makes life easier for you and helps you remember the 90-day update rule. Just please keep in mind that you may not share this password with anyone because it is especially important to never share passwords for the health record or the network because we wouldn't want a security problem. Okay, so I'm going to hit cancel because I'm not going to change my password yet. Okay. And then I'm going to be back to my profiler screen, but of course you would choose change a password. So I'm going to go to the globe that says Profiler 15 and double click on it. I'm going to go into Norfolk Training. That is the database where you can play around with charts without actually saving them or messing up anything in the actual profiler system where our real billable medical records are. Okay, so I am going to do Norfolk Training, but of course if you're doing a real pre-screening, then you are going to choose the one that says Pick Me. Okay. You can either double click on it or select it and click OK. And it should launch open a screen. Okay. The training database will always say Norfolk Training at the top, and it should have your name beside it. Production will say production. This way you'll know whether you're in the training system or in the real system. You don't want to get those two confused when you're doing your real charting. Okay. So there are two different sort of tracks for emergency services. One is easier, and that is, well, what do you do when someone already has a chart in Profiler and you're sure that they do? The second option is, what do you do if you need to do a brand new chart in Profiler because you weren't able to find their file? So the first one I'm going to do is our repeat clients. Okay, so what if someone already has a chart in Profiler? So I'm going to cover those steps first. So I'm going to click on this button that says Navigator. It looks like a compass. And this is where I'm going to put either the client's ID number or their name. You don't want to use a comma to separate the first and last name, but you can do the last name first or the first name first. Just please don't put a comma in there because the system looks for it to be a part of their name. So I'm going to use, I believe the client I have in here is Hermione Granger. Okay, and then you can either hit tab on your keyboard or search with this magnifying glass find client button. Perfect. Okay, so it found her, it loaded her client number, it has her name, date of birth, and age at the top, so I know exactly which person it is. If you get this option that says no selection, That means that there's more than one client with that name in our database. Okay, so you want to click on the down arrow, and then if there was more than one person with the last name Granger and the first name started with H, I would see a list, and then I could just check the date of birth, age, and ID number to make sure that I'm charting under the right person. Okay, so I'm going to select her. All right. So now that I have her in the system, there's a couple of parts that we have to do for emergency services. We need to do a referral and call sheet. We need to do our pre-screening, and then we need to do the diagnosis and billing piece of it. So I'm going to start with a referral, and to do that, I'm going to go to the referrals button right underneath her name. In the client section, and you'll hear me talk about the different sections. This section refers to the client section. This section refers to company. I can see that she's a very recent client. She's only been our system since July of 2020. Okay, so that's, if you hear someone refer to the different levels, you'll hear client level, company level, episode level, and it just refers to where things are in the different sections of the chart. Okay, and the buttons that we need for emergency services are here. So I'm going to go to referrals. Okay, I can see that she does not have any existing referrals, but even if she does, if it's a new call for an emergency services option, I would still do a new one. So I'm going to click on the plus. Okay. The date up here is the date and time that the referral was made. The type, if this is a referral from a hospital, so let's say an emergency room called us, that would be from external. If it's a program at the CSB, it would be within Norfolk CSB. To external referral, that's an option that is not used by emergency services, just like this one that says do not use, okay? So from external is if someone is calling, like a police or someone outside of the CSB, and within Norfolk CSB, if it's a program that we have that's calling for your help. So I'm going to do from external in this example. The provider is going to be your name. The triage level for emergency services is always emergent. We try to get to these cases within 1 hour time frame, which is why we label it emergent. So that's easy. Since you're working in emergency services, it's always going to be emergent. Okay. There's a trick to this referral company drop down. Okay. So what you want to do is put a keyword in there. So I'm going to put Centera and then click the drop down. Then I will see the full range of Centera locations that we have in our system. Okay, so let me try police. Let's see if that's one. They'll see there's no records that match. So I'm going to put in Norfolk. So see how Norfolk will pull up Centera, Norfolk General, also Norfolk Public Schools, Norfolk Pediatrics if it's a doctor's office. So give it a key word. There's also one called Other. So if you don't find one that matches, you can also do Other in the arrow and select another option. But I'm going to do Centera. And we'll do Centerally. But of course you would put in the choice that best matches who called us. The caller, this is where, who did we speak to? Tiffany Jones, RN, and then the phone number we can reach her back at if we need to. I'm just making up a number at this point, but you kind of get the idea. Relationship to client is going to be typically what makes the most sense according to who's calling. If it's a family member or parent who's calling, you would select that. In my example, it is, I'm going to select professional, but obviously a doctor could call, a guardian could call, a person could refer themselves. So you just pick the choice that makes the most sense. And so in this case, I'm going to choose professional because it's a nurse at the hospital. Referral source, I am going to choose, let me see what the best choice is. Private hospital. Okay, there's primary care physician, self, school system, very similar to the relationship to client option, except it's more of a category of location and not necessarily, you know, a specific person. So there is one for CSB internal referral if another program has called emergency services and used this option. So I'm gonna, and you see there's also a state hospital one, but that's like Eastern State and things like that. So I'm gonna use private hospital. You just pick what makes the most sense. If it's detention, then it's detention. Presenting problem is what's the call related to. So SI has threatened, I'm sorry, I can't talk and type at the same time, to jump off roof of hospital, request pre-screen. Okay, so that's just an example. I believe that's actually a real example that I've seen before a couple of times, but you want to put what the very small, short and sweet gist of what the emergency is. And then over here on the right, so the left-hand side has to deal with where we're getting the call from. And on the right-hand side, we're going to select company, Norfolk CSB. Now this option is probably going to change for you soon. But as it stands today, which is August 28th of 2020, emergency services is still under the location of Virginia Beach Boulevard. We had a lot of our programs move around and we are going to update some of the locations, but for right now, your location is going to be Virginia Beach Boulevard Center because that's where ES used to be. And the cost center just means program, is emergency services. So emergency services is taking this call, okay? There's also a drop down here, ES, female with dependent child at home. That is a yes, no, unknown, or male NA. I'm going to say no because she is a female, but she does not have any children, but that is an option for you as well. That's just some information that we mark, I believe, from the state. Okay. So now I'm going to go up to this section called Notes and Dates, and I'm going to click Effective. Where this says Referral Destination to External Referral, for emergency services, you're going to put NA Internal because we are we're not referring this patient out. We are taking this person in. Okay. Then we go to the bottom, okay? Now at the bottom, hope you can see it, there is save, save plus, cancel, report, and UDD, okay? We want to go to the one that looks like Internet Explorer that says UDD. This is where our call sheet lives in Profiler. So in this case, I'm going to click on the plus. I'm going to add a call sheet. ES call sheet is the only form in this drop menu. And I'm going to select open. It will pull the identifying information from the chart that we're already in. Okay, so this is the address, date of birth, gender, and the ID number. And then this is the call log. So I'm going to do today's date. I'm going to do 2 p.m., but obviously you would do whatever the date and time actually is. I'm going to do 2:10 p.m. You have to select AM and PM for ES because we could have calls that run from like 11:59 on one date into 12:04 on the next date. So just kind of make sure your AMs and PMs are right. I believe I can't remember what the caller name was. I think Tiffany Jones, I said, RN, nurse, Santara, Lee, caller phone number. It would basically be the same information from the previous sheet, but because I made up all the information, I don't know exactly what it is, but that just tells you what to do. Okay. I'm getting an invalid phone number. I forgot this slot puts the dashes in. So you want to make sure you don't put double dashes in. That's the error message that it just gave me. The type of call. Let's see, and then you put information, crisis intervention, counseling, pre-screening, other, whatever the type of call is. And then whether we're going to do a pre-screen, that's the UPSF. That stands for pre-admission, universal pre-admission screening form. A lot of letters around here, but that's what that stands for. Then of course you would present presenting problems, danger to self, present location, Santara Lee. And then in previous psychiatric hospitalizations, you have ESH, which stands for Eastern State. You have CSH, RBHC, BBPC, which I know is Virginia Beach, Psych, and Santara Norfolk General. So if they've been previously hospitalized somewhere else, you can pick other and then put that. If they have a current therapist, psychiatrist, primary care, if you know it or have that information, if you know they're on medications, yes or no, and if yes, you can list it and whether they're compliant. So let's say they are on Zoloft, and that's saying that they're not compliant with it. So, and then you're just checking these boxes. Yes, 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 yes. And then just whatever makes the most sense. Okay. So let's pretend I filled in all of that because really it's just filling in the boxes. And I don't want to take up all your time for just you watching me click boxes, but you get the idea, you fill it in, and a lot of these are going to be unknown, especially at the outset when we don't know what the situation is yet. Then you just use save when you are done, and then you select effective, which is the date that we are logging this. It should be the same date as the referral. So I'm just clicking the box and it will mark today's date. Then I'm going to do save. And then you'll see the call sheet is there and it attaches. So I'm going to select close, and then I'm going to select save. And then now my referral and call sheet is done and it's stored there. Okay. There is a trick to get back to the front of the chart from this box. If you click over here on this tab that says criteria, it just flips right back to the front and you will be right where you need to be to do your pre-screening. Okay. So the pre-screen is what we call a UDD, and a UDD is just forms that we made up and put in Profiler, electronic forms. The place that the pre-screening UDD or form is located is over here directly to the right of the client ID number that we put in to pull up the chart to begin with. In this, it looks like a little really slim green plus or cross with the tiny little letters UDD underneath. which stands for user-defined data or forms we made up. I'm going to click on there. Here you can see any forms that have already been completed on the person. So sometimes in emergency services, you need to know whether we have a release on someone to speak to someone. If we do, it will be in this list. It will say ROI, release of information. And then next to ROI, you'll see whether it's a primary care doctor or emergency contact ROI or a family member or other. And then you'll see the date that the release is good for, okay? So you want, if we have a release to speak to someone and it's valid, it will be within a year. Releases that are past the year mark are not valid anymore. So sometimes that's useful in emergency services when you have someone who is calling who wants information about a client and you want to know if you can give it to them. So if you see an ROI or release of information in this list, you just double click it, hit open, and you'll be able to see who that release is for and whether we can talk to them. Okay, so now I'm going to click on this wide plus, looks like plus a piece of paper. So that's to add a new form. And in the form dropdown, remember we said UPSF stands for Universal Pre-Admission Screening Form. So it is all the way at the bottom because they are in alphabetical order. So Universal Pre-Admission Screening Form is the form that we want for ES. So we click on it. Now, here's a trick. If the person has had a pre-screening, okay, and especially if it's recent and you want to copy the information from one pre-screening to another, in this clone drop-down, you'll see other pre-screenings that the person has had and the date, okay, that they had those pre-screening. So normally what staff do, especially if it's a repeat client, maybe we did a pre-screen on them last week and they're decompensating more this week. We can clone from the last one, which means copy from the most recent, and then hit open, and then you just update the information that is different. In this case, she doesn't have any recent pre-screenings or any pre-screenings in her list. So we don't have any pre-screenings to copy from. So we are going to select just open. And then here is her pre-screening, okay? So we are going to fill in this pre-screen form as best you can with as much information as you can. Okay, some of the boxes are type. Some of them are check boxes. You just go through this form. A lot of it's diagnosis, treatment history, things like that, mental status exam. You're probably going to get training in this in your specific program, which is ES, but it also is a form that if you've worked in emergency services anywhere else in the state recently, it should look very similar to that because it's a standardized kind of a thing. So I'm going to scroll down. Let's pretend we finished it. When you finish it, you do click to e-sign, and then you save it if you want to be able to come back and change anything to it. There was a final save button there as well. If you have completed this form totally and you want to lock it down, that's the final save button. It means that you can't make any changes after you click final save. The effective date is the date that you did the pre-screen. Okay, so the date you saw them for the pre-screen, and then save. And then you can see that there is a pre-screening in the list. And to view it, you just double click and select open. And then the form will show and all the information that you did will show. Okay, so I'm going to close that out. I do want to go away from this page. So when I was talking about copying from the last pre-screen, it should show now. Okay, see where it says clone from? Yes. So if I just did one earlier today and then get a call later on tonight that, oh no, you know, they need to be pre-screened again, I can copy from my last pre-screen, or even if another emergency services staff did the last pre-screen, you can still copy from it too. But you want to definitely update all of the information as needed and then assign your name to the completed pre-screen. Okay, and then you would select that and then do open and then update it as needed. Okay, but I'm going to cancel that. I just wanted to show you how it works. Okay, so I'm going to do close. Okay, so I've done my referral and call sheet and I have done my pre-screening. Okay, now I need to do my billing. Okay, there's two pieces to it. One is we have to enroll them into emergency services. So we have to say that we saw them in emergency services and what date we saw them on and put a diagnosis in. And it can be a preliminary diagnosis or just your general perception of what the diagnosis is based off of the pre-screening. Okay, so we've got to do that first and then we can put our billing documentation in. Okay. So the first thing I'm going to do is I'm going to click Profile of Client. Okay. Profile of Client is like their face sheet. It tells you their last name, first name, it's where their social lives, their date of birth, gender, all of that stuff. This is the information that will already be there when you have a client's chart who is already in the system, but it will not be there and you will need to fill it in if it is a new person who has not yet been seen at the CSB. So just kind of keep that in mind as we come back to this later. Okay, so I'm going to choose the tab called Plan of Care. And then I'm going to choose the button that says Filter List. Okay, so I can see that Hermione is enrolled to iCare, which is our integrated care, our psychiatric clinic. So she sees one of our psychiatric doctors, and that she is also enrolled to intake. But I can see that she is not yet enrolled to emergency services, right? She had, because we're doing her first pre-screening today. Now, one other trick, okay? I can, let's say I wanted to see the progress notes for iCare and intake, okay? Or case management or whatever program they're already enrolled in. If you go and select from in the upper left, I'll say from January through today, select recorded services and filter. Let's see if I get any. Yes, anything in this list are notes that have been completed on this client during that date range. And all you have to do to read them is just to double click. Okay, so if I double click on this one from Dr. Forte, his progress note, now remember this is a training client, his progress note would be here and I could double click and read it. Okay, so you have access to review any documentation that anyone at the CSB has already done for your client, and that may be useful information for you when you are trying to decide what's going on with this person. Okay, I'm going to go back to the dot that says cost center and filter because I want to go back to adding a cost center. But just know that, you know, even before you do your pre-screening, or if you ever want to read any notes on a client, all you have to do is hit that date range and recorded service and you can see any notes that have been done by a provider at the CSB. Okay. All right, so, oh, sorry, I'm going to do treatment plans and filter, not cost center and filter. Okay, that's what happens when you're recording a video live as you're doing it, right? So it's treatment plans and filter, and then I'll see the treatment plans that the person has. I want to add, so I'm going to click on the plus, a treatment plan for emergency services. And the location, remember I said we were going to play around with the locations, but for right now, emergency services is under the one called Virginia Beach Boulevard, and it's towards the bottom because they're in alphabetical order. The cost center is just the program, so we want to select the program for emergency services in this drop-down. Select filter, click on the text that shows up in this box, and you'll see that it will mark this treatment plan box with emergency services here. The plan status you want to make active, and this effective date and time is extremely important. Okay, it trips up a lot of staff. So for emergency services, because you could do services anytime, day or night, we always set this back to midnight for whatever day this whole process starts. Okay, so right now it's about 2:30 p.m. on August 28th. I'm still going to set it back to midnight. That is a process very specific to emergency services. I'm going to now pick save at the bottom. The save takes a minute. It's going to launch a plan that is very specific to emergency services. Now, emergency services plan is just an admission or enrollment. It does not have problems, goals, or objectives like a case management plan does. So if I pulled up a case management plan, it would look very different from emergency services. All this plan does for emergency services is allows me to assign this client to myself, that I'm the one who provided this service for them, and it lets me put in the diagnosis for this particular pre-screen visit, okay? So that's where I'm going to start. The diagnosis box, I'm going to click the plus. The diagnosis drop down, you're always going to choose ICD-10. This is a little bit tricky. You want to highlight the section that says no selection. It's real tempting to hit this drop down, but you always want to go here and do a keyword or the ICD-10 code if you know it. I still have all the DSM-4 codes memorized, but not the ICD-10. So then I'm going to click on the down arrow. Here we go. I'm going to do schizoaffective disorder. Okay, so you can put in, and I don't know how to spell schizoaffective, so I just put in the first part of it and then hit the drop down and got my choices, and then I can select which ones. The diagnosis type is going to be their principal diagnosis because it's the one that is sending them to care today. Okay, it could be a substance use disorder, it could be a mental health disorder. The provider is going to be me because I'm the one who's making the diagnosis based off of this pre-screen that I'm doing. The effective date is the date that I'm doing the pre-screen. So remember, if you're putting this stuff in late, let's say I did my pre-screen on yesterday, but now it's today when I'm adding all this stuff in, I would need to make it effective yesterday. Okay, so it's much more beneficial if you're actually doing this on the exact same day that you did the pre-screen. I highly recommend that, but I know sometimes you're running around from place to place. So when in doubt, the effective dates always need to be the pre-screen date. Okay, so I'm going to click on this tab that says link. My principal diagnosis is always going to be number 1. And again, more date boxes. So I'm going to select the same date. I want all these dates to be the same date of my pre-screening because I'm going to bill under this diagnosis and it has to match. The date on the diagnosis has to match the date of the pre-screen. So I'm going to click save here. Okay. Where it says emergency services, I'm going to double click. Where it says provider, I'm going to click on the plus. And you can start typing your last name. Okay, so this is me. and my role is primary provider. You are the primary provider of this pre-screening. So they may have a primary provider in another program, but you are always the primary provider of this service. So that's what it's talking about. Click effective date. Again, the same date as my admission to ES and the same date as my pre-screening. I'm going to click OK and then save. Now I need to sign off on this, okay? So I'm going to click signature. Next review date, we tend to put 30 days. So I'm going to put September. That's about 31 days. That still works. We try not to leave people hanging open in emergency services because it's a short-term service. So I'm going to click all and show. Your name should show up here, so you're going to double click on it. Check the box, excuse me, and then click OK. Says yes, and OK. Signature complete, that's what we want. We have our diagnosis here, and we're going to select save. Okay. Now we want to put our note in. Now this is not a full-on progress note. This is just a stamp of when you saw them. I saw them from this date and this time, and it triggers the billing for that period of time. So from this same screen, you're going to click Plan Services, Filter. And I'm going to get a ton because this person is enrolled to more than one program. So to make my life easier, I am going to go to the cost center or treatment plan that says emergency services and then hit filter. Excellent. And then I'm only seeing my emergency services ones. Okay. So this is the time where you can say, am I doing a pre-screening or am I doing an under ECO? Okay, so that is a clinical choice that you have to make based on what you did. So I'm going to do, I did pre-screening. You do one click on it, that's really important. 2 clicks will open up an additional screen that you'll have to cancel out of. So you want to do one and add. Okay. The start date and time. This is when did you do your pre-screening? Okay, so if I started this at 2:08 and it took me 60 minutes, that is what I need to put, okay? Because you're saying I saw this person from this time to this time, and that's the period of time that I am billing for. Your name should come up in this primary provider box. That's who did the pre-screening. Your delivery method is usually client present for pre-screening, except we have this awesome option called telehealth right now because of COVID-19. So if you were seeing someone via video or doing a pre-screening with someone that way, that's what you would choose, the telehealth option, COVID-19 face-to-face by telehealth, okay? Or client present if you were physically with the person. The place of service is where were you, okay? So this says where, if you were at the CSB site, that's the one you choose. If you were at the client's home, that's the one you choose. If you were in the hospital, so, my example was Centera Lee, right? So I'm gonna do non-state medical hospital, and then I did a face-to-face through telehealth to assess them at Centera Lee. Okay, so you just pick the best fit. Here where it says progress notes, I'm going to click on the plus, and there is a template. So I'm going to click on this drop down, and there's one called Emergency Services Pre-Screening. It fills in the note for you. You don't have to type anything. It just directs the person if they want to know what happened, look at the pre-screening. You've already done a pre-screening, okay? So that should make your life fairly easy. All right, and then what you want to do is, I always go to the last date box at the bottom. Okay, what it does is it automatically checks all the other ones. So it's one click that checks multiple boxes, which makes things faster and easier for you. And then I'm going to click OK. There's a question here about the Columbia Suicide Risk Assessment. Emergency Services doesn't have to do that because you're already doing a risk assessment with the pre-screening. So you just click on OK. You're not required to do a Columbia. There is a service subtype at the bottom of this screen. Now, if you miss it, right, if you don't click on it and you hit save, it will tell you you missed a box. So don't worry about it. It's not going to let you forget it. You click on the down arrow, and I said that this was a crisis intervention, so that is the one that I'm going to choose. You also have different options here under ECO, commitment hearing, various choices, and we're actually going to add another one for pre-screening that says pre-screening very shortly, but you just pick the one that makes the most sense. Some of these are case management service items, so you do not have to use them. Okay, so I'm just going to pick the one that says crisis intervention for now, but that change is going to be coming in October and you'll get more information on it. Okay, so I'm going to choose save. Okay, so at this point I have done my billing, my admission, I've done my pre-screening, my call sheet, and my referral. I'm done. Okay, so save and done. Okay, so yay, we made it through. Okay, so I'm going to close her chart. Now what happens when you get the next call and you go to Navigator and his name is, oh, all caps, Harry Potter, and it says there's no clients that match? Then what do you do? Okay, that's part 2 of this video, which is if someone doesn't already have a chart, what do you do? Okay, people are tempted to go to this button that says new client, but we really need to start with the find client button. This is an in-depth search just to make sure, because I can't even tell you how many times we've had duplicate records saved in Profiler because somebody gave us a different name than their name, right? Or someone changed their name since the last time we saw them. So what you do is you hit search. I always start with the social. So I click next to the one that says social security number. If you want to do the last 4, you can click the down arrow, hit ends with, and do any 4 numbers. I'm just using this as an example. And then OK. See how it did like this little swoosh refresh, but there's nothing that came up here? It means it didn't find anybody with the last 4 of that social. That's a good thing. Okay, it means that we're not going to create a chart on someone with those last 4 of the social that already belongs to someone else. However, sometimes we can't get socials on people. So we're going to do another search. We're going to come back up here to this little dot that says simple find. We're going to click simple find and search. Now I'm going to do birth date. I always do social security, birth date, and then name. Okay. So, and there's a trick to this birth date because you don't want to calendar over to 1962. So you use your number key. So I'll do January and I'll put 15, 1962. Okay. And then, okay. See how I got 3 clients with that same birth date, right? I got a match. Now, I'm in the training system, so if I was in the active system, what I could do is I would see the socials. I would see the last name and first name here. The L stands for last and the F stands for first, but the identifying information is scrambled to be HIPAA compliant on the training database. But then I would be able to see if I'm like, oh, I have a birth date, right? I found this person. If that person's already in the system, you'll be able to double click, go right to their chart, and you can proceed as normal. Okay. If these people pull up and none of them are the client, okay, then I could go to simple find again, search, and my last name is Stewart, so I could put last name starts with STE, okay, swoosh, nothing. Okay, so then I can hit cancel. I know before I hit this new client button that I am not creating a duplicate chart because I have looked under name, social, and date of birth. You do want to check all three. It's a little bit more work in the front end, but it is a lot less work than trying to undo a duplicate record that you've created by mistake or accident. Okay. So then you do new client. It will say you're about to create a new record. Do you want to continue? You say yes because you have done all of your research and made sure you aren't creating a duplicate. There's a couple of extra pieces to this, right? You're going to do everything that we already did, everything that I already showed you, except for first, we need to give this person, that's a good middle name for Harry Potter. Harry, I want to put Marie for everyone. Marie sounds good with everyone's name, but you know what I mean. If you have a middle name, you definitely want to put it in, because if I have two people with the same first and last name, it makes it a million times easier to find them. Okay, these ones you can skip unless they're a junior, senior, the third. Okay, then you could put that. Social security number, I'm going to make one up, but you want to put their real social in there. Status means declared if they told you, or verified if you're looking at their card. So you're usually not looking at their card, it's usually declared. Gender is very important, okay? The last and first name has to be their legal last and first name. Their gender is whatever they say their gender is. And Harry Potter is male, but you see you have some options here, okay? Birth date, what did I say? I said he was from 1962, right? January 15th, 1962. You can use your number keys for this as well. And I'll say I saw his ID, right? So that would be verified. Please don't accidentally fill in this deceased. We will get an error if we're providing services on someone we have marked as deceased. Okay. All right. Aliases is if the person goes by something other than their legal name. So if Harry hates his first name, or he goes by a nickname, or something else, then I can put a different name. If there's also, let's say, especially for usually if someone has a maiden name, okay, there's also an alias type for name change, if someone's legally changed their name, preferred name, maiden name. So you can fill that in if needed, okay. That helps with rapport too, to call people by the right name. We try to be person-centered around here, so we want to call people what they want to be called. This is where they have a CSB appointed authorized representative. Okay, I'm going to say no for this. If he has a court appointed guardian, okay, so I'm going to say NA. Does he have an advance directive? I'm going to say no. If yes, we want that paperwork. That's why it says see attachments. And waiver type is just for intellectual disability, so you leave that blank. Okay. So another piece of the chart that has to be filled in for the person when they don't have a chart yet is what's called personal demographics, and it's this button right here. I don't know why all these icons are compasses, but it's the one called personal demographics. On clients that are already in the system, you can just leave their personal demographics in there. They will already come with personal demographics. You can update them if you want to, the individual parts and pieces. But on a client who has never been in our system, they will not have, obviously, any records saved to their chart because they don't have a chart yet. So I'm going to click on the plus, and then I'm going to fill in all these little boxes. So employment status, whether he's employed or not, and why. We'll say he is not in the labor force due to disability, but you pick the one that makes the most sense. Effective date is the date you're adding it. So I'm just going to click on today's date. Citizenship, we'll say he is a U.S. citizen. Effective, okay. I think he actually lives in England or something if we're talking about like the character. Marital status, we'll say separated. Effective and okay. Language, we'll say English. Fluent in English, okay. Education is the highest level of education completed. So if he graduated high school, then or got his GED, we'll say grade 12. We also have college options. The one that says do not use, you want to skip those. Those are retired. The reason why we have to do these is that we report out all this data to the state, which is the Department of Behavioral Health and Developmental Services. Yes, thank you. And I'm going to go to this additional info tab, and they require it for all of our folks. Okay, so they give us funding, we give them data. Okay, so we need all of this data. You will find if there are categories of data that you are not able to get, there is unknown for each of these. Okay, so if the living arrangement is unknown, I can select unknown. But there are also ones for homeless, residents, boarding. So you just, all of these choices, you just pick what makes the most sense for the person. Legal status, whether involuntary, we'll do voluntary for him because he's not court ordered. He's not a veteran. Okay, the ones that do not have green around them are optional, but they could be helpful. So if his religion is Catholic, that might be useful for us to know. And let's see, his sexual orientation, we will make him bisexual as an example, and okay. And again, unknown for any of the ones that you don't know. I'm going to go to this notes and dates tab. You make it effective date, the same date you're entering, you're making the chart active. He is not applicable for substance abusing and pregnant. Again, not applicable for dependent children. Peer recovery in the past month. That is if he has gone to AA or NA or any of those types of peer programs. I'm going to put NA, not applicable in this case, not Narcotics Anonymous, but you know what I mean. If he's gone to any of those peer type services or groups in the past month. Military status, I'm going to say not applicable. If it does apply, or if they're a military family member, there's dates here. These are really important here where it says cognitive delay. See how that says 3 to 6 years old? I made him born in 1962, so it's going to be NA for him. And see here where it says SMI 18 plus, SED, and at risk is kids. So I cannot use at risk or SED for him because he is out of that age range, and the state will flag our answer and make us fix it. It will be an error, okay? So I'm going to choose serious mental illness for him because he is presenting with a serious mental illness to ES, okay? Prior episodes of substance abuse treatment, you have some options here. And number of arrests in past 30 days. I love this drop down because it's a ridiculous number of arrests. We'll say 31. Isn't that crazy? 31 arrests. They wouldn't let you out at that point, I don't think. Okay, so then I'm going to click save. And I know I haven't been going over all of the details of all of the drop downs, but I needed to do that one because that's a state required field. Okay, so if you have any questions about demographics, please let me know. I'm going to close this window with the X. Okay, so then I am back onto this screen where that base sheet was. And so I'm going to go to addresses and I'm going to click on the plus. Even if someone is homeless, we have to put in an address for them. So there's one called homeless or residence, which is what we use the most often. So Harry Potter, 3755 Central Business Park is what we use for someone who is homeless. We hold their mail. We don't send mail to them. We put our main CSB address. I don't remember what the zip code there is. I'm going to put my zip code in here, but you would put the zip code for that building as well. If you put in a zip code, now obviously if they're not homeless, they have housing, you would put their street address there and apartment number if it applies, okay? You would put their zip code. And when you put in a zip code and hit tab, it will fill in this city and state and everything for you. I'm also going to click receive statement. Then it would be effective today. If there's also a phone number tab here, so I could go to phone number, hit the plus, and let's say he has a cell phone number. I can type in that cell phone number. Click effective and OK. And then I can hit OK here. So now I'll finish his base sheet, his personal demographics, address and phone number. And now I'm going to go to this tab that says notes and dates. And I'm going to make this whole record effective. Now, a lot of these boxes are green. They will remind you if you forgot them. I just have them memorized. So if I went to hit save and I had not gone to this box, it would say you missed a box on this field because it has a green outline. So it should tell you if you missed something. Okay, so when I went to save, it says 7 desired fields. That means we like this information if you have it, but it's not required. So if you get this box, you can say no. And I'm going to say no on this also. So now if I go to Navigator and type in Harry Potter, he has a chart. The system generates the chart number automatically for you. So now I know his new chart number, I know his name, date of birth, everything, and all the information that I did is saved. So now that he has a chart, then I can go in and do my referral and call sheet. I can do the pre-screening form. I can do the admission, diagnosis, and billing for him, the exact same as I did in the beginning of this video with Hermione. But I had to create that chart first. Okay, so just remember, a little bit different if you have to create a chart versus there's one that already exists. The one that already exists is faster, right? Because you're just adding the new information in. The one that you have to create a chart, we have to first make sure that doesn't exist in the system and then fill out all those basics to create the chart before we do our referral call sheet, pre-screening, and all that information. So I hope this has been helpful for you. I am appreciative of your time and sitting through this whole training, and I hope that you can refer back to this if you have any questions. Please reach out to me. I very much appreciate it, and I will talk to you soon. That's it. Thank you.